AdvoKAYte, holding healthcare accountable. This podcast is my way of sharing what I've learned about the mistakes, the cover-ups, and the ways we can all protect ourselves. We're all in this together. Hello, everyone, and welcome back to another episode of AdvoKAYte, holding healthcare accountable. Today, I'm just tickled to have as my guest my friend and colleague, Lisa McGiffert. Lisa has spent most of her adult life advocating for patient safety. I came to know Lisa through her work in an organization she created called the Patient Safety Action Network. And so without further ado, I introduce you to Lisa McGiffert. Hi, Lisa. Thank you so much for taking the time out to join us today.
Hello, I'm glad to be here.
Well, listen, I want you to talk more about your lifetime body of work in patient safety, and in particular, your work with what used to be Consumer Union, now Consumer Reports, which most people know Consumer Reports because that's where they go to check it, myself included, to check out before you buy a washing machine or a microwave or a car. But tell us more about that.
Well, Consumer Reports is a nonprofit, and the money that they make through selling their magazines with the testing information all goes back into advocacy efforts to try to change policies and laws relating to consumer protection, and so that includes health. And I worked for Consumer Reports for 27 years, and we first worked in Texas on all kinds of healthcare issues, the whole broad array from universal healthcare to medical boards to quality of care. And then I headed up a national campaign that created state laws to require hospitals to publicly report their infection rates. And when we did that, it was like a campaign. We engaged people from all over the country, mostly people who'd been harmed or had a personal experience with a family member, and they became the advocates that helped us pass these bills at the state level. Mm-hmm. And eventually, the federal government actually required the same kind of reporting. Much of our work has been on infection, but we also have a very robust committee called the Medical Board Roundtable that works on physician accountability and medical board issues specifically. And we have another group that works on medical device safety. The rest of us work, we all work on all kinds of patient safety issues from the perspective of changing policies so that there is more transparency about medical harm and more accountability. The fact of the matter is that we have a lot of laws that are supposed to protect patients, but the agencies and people responsible for implementing those laws or, making those laws work often don't have the patient's interest as a priority. And so we work mostly on trying to get that kind of accountability in the system.
Well,
so when I retired, I'll just say this.
Yeah.
When I retired in 2018, all those people around this country that we worked with and I formed the Patient Safety Action Network that I'll probably refer to as PSAN in short. And so we are a national nonprofit, and we have a website that people can see what kind of work we're doing. So we continue to work on what people are interested in pursuing, and every person sort of chooses what they work on. We've had numerous members that have been appointed to medical boards to serve on medical boards. We have people who work at the state level and the national level.
If somebody wanted to get in touch with your organization, of which you founded, you're now the president of PSAN, how would they get in touch with you?
Well, the best way is to go to our website, which is patientsafetyaction.org, and they can do it that way. They could also ask to join our Facebook page, which is, I don't think I have the exact link, but we can get it.
Okay, sure.
And ask to participate. That Facebook page is really for patients and people who want to get active in support of patients. It's not for healthcare providers or, people lurking around trying to see what we're doing. It's for an exchange of information. And we have thousands of members of that Facebook page.
So who would be your ideal person that you would want to contact you? A patient or?
Sure, or family members. Most of the people who we've come to know through our work are people who often had a family member harmed, and are outraged, and they want to make sure that it doesn't happen again to anyone else.
Yeah.
So there's lots of routes that people can take, and in the context of our discussion today, many of them find out that they filed a complaint with the medical board, about a doctor, and that's it. They never hear anything else.
Yeah.
And so we have a number of people who monitor their state's medical boards pretty regularly and attend the meetings and speak at meetings and that kind of thing, and keep up with the activities that the board is doing in various states. So that's a typical way people have gotten involved. Sometimes family members harmed in a hospital or another kind of health facility, and they file complaints with, say, the Medicare agency, CMS, and they find a wall. They can go so far, but they can't get very much information back, and they can't get much accountability.
Yeah.
And so they're motivated to make that system change. A lot of it is about responding to complaints that patients file. And people get mad, when nothing happens, and when they can't see that there's been a real change in a facility or with a doctor.
Well, we need people to get mad, and we need people to get motivated, and it shouldn't just be the people who have had their lives destroyed as a result of it. And, we talk about this all the time, that we have to have a movement. All of the things that we're trying to do for patient safety, part of why we can't get, a billionaire to take up our cause or the government or politicians is because we don't have a bunch of money or a big movement, a mailing list of 1 million people or whatever, 1 million people to march on Washington. So, I'd like to just also chime in to contact the Patient Safety Action Network. Would be one place to go. We'll take all the help we can get. But the work that you all are doing is so great. I've been fortunate. I raised my hand and I said, I don't know if you'd take me, because I don't know if you'd take lawyers or not, because most of the people are involved in the healthcare system in some way or another. And you guys were so gracious to say, yeah, come on aboard. And I've been privileged to get to know you, Carol Cronin, some of the people you've mentioned who have suffered terrible losses, and they've become patient safety advocates. But something that we talk about all the time is, patients don't have an American Cancer Society. They don't have the American Heart Association. They don't have the Susan G. Komen. It's just a ragtag group of well-meaning people who are out there crying from the mountaintops, trying to do the best we can. What do you see in your lifetime body of work that you think could change this and have our voices heard?
Well, money does help because you can hire staff who work on this all the time. And when I was working for Consumer Reports, I was able to do that. I spent every day learning about the policies, organizing people, but it's very hard to get people to engage in issues around medical harm if they haven't had a personal experience or known someone who who is harmed. People don't really want to think about it. When we go to the doctor, we want to believe that everything's going to be taken care of and that we're in good hands. And this is essentially one of the issues that we constantly deal with, is that people put a great deal of trust into our systems.
Mm-hmm.
So when a doctor gets a license or a hospital gets a license, for example, the public believes that there is someone making sure that those medical professionals are doing what they're supposed to be doing, that they have the knowledge, competency, and safety record that will take care of them at their time of need. Because we can't know all the things about medical. We have to put our trust in these professionals. And so I would say from my decades of work, it's pretty hard to get people involved if they are not personally affected. So, when I've organized about insurance issues, almost everybody, is affected by cost issues, insurance issues, those kinds of things. It's easier to organize around that, large groups. But when it comes to patient harm, it's difficult. And, and it's difficult to get everybody to work on the same thing because people see different parts of the system that is a problem, and they want to work on that. They want to work on regulation of oversight of physicians or safety of medical devices, or infections. It usually is a very personal choice. And a lot of these people are quite passionate. They've been at it almost as long as I have, and they are still committed to doing the work.
Well, thankfully so. But I think the message that I try to get across, and you've heard it before from me, is, look, everybody is a patient.
Right.
Politicians, you're a patient. Everybody you love is a patient. Oh, guess what? 100% of your constituents are patients. And, I know what you're saying. We have to trust. We don't have to blindly trust, but we're vulnerable. We're all vulnerable when we're patients. And so there's kind of a balance between, you don't want to scare people to death and have them not going to the hospital or not going to the doctor. But on the other hand, you want to educate people to say there are real issues out there. And who knows who's going to get the lucky lasso, as they used to say, in Texas, who's going to get the lucky lasso. But
and that's why we focus on transparency, because when people seek information on safety, we want them to be able to find it. And I would say the medical system, the whole medical industrial complex, and all the organizations of doctors and hospitals, there's one thing that is prominent, and that is secrecy.
Yep.
And they often say, oh, it's because we have to protect the patients. And that is not really what's going on here. They really want to protect the professionals.
Well, we're going to talk about that for sure. But before we get into it, to me, the irony of you having worked for Consumer Reports for 27 years is that there really needs to be a Consumer Reports for patients. Now, thanks to all of the work of Consumer Reports and others, we can find out a lot of details about washing machines, microwaves, cars, whatever. And it really helps consumers. But, making a bad decision on a car, unless it's a safety issue, or making a bad decision and you got a bummer of a microwave and it frizzled out after 6 months or something, these aren't life or death things. But transparency, transparency, transparency. Accountability, accountability, accountability. Yes, there are a whole bunch of issues. As a friend of mine used to say, we can't boil the ocean with all the issues, but they mostly come down to just a few key things. And one is a lack of transparency, and the other is a lack of accountability. And the third is follow the money.
Yes, yes. And part of it also is to have more public participation in these boards and committees and agencies that oversee what's going on in our medical system, because the public has a very different view of what should be happening when you have a bad doctor who's harming patients because they're incompetent or criminal sometimes. We did a poll in 2011, a survey at Consumer Reports, and 89% of the people surveyed think that the doctor should not be seeing patients if they're on probation or have any kind of suspension or conditions on their license until they fulfill those conditions. Mm-hmm. Then they can start seeing patients again. And that is not what happens in reality. We have many doctors on probation who their patients have no idea that they've been cited by the board for some kind of problem. And I would say that I think it's important to recognize that there are the majority of doctors are not a problem.
Right.
It is a small minority that harms often many people.
Yep.
Same thing with hospitals that allow things to happen. And we want to get at those. Yeah. And we would love to have that medical associations and hospital associations really get behind it and push for getting the problems out of there.
Yes.
So everybody can do a decent job and provide safe care. That's our goal.
It's to everyone's best interest. Well, let's talk about medical boards. And it's not just Texas, but I'm primarily going to talk about Texas because that's where we both live. You're an Austinite. I'm a Dallasite. But one of the cool things about the work that we do is getting to meet cool people who are doing great work. And I would say, you and I could say he's a young man, because to us, he is a young man. There's a young man in Austin, an investigative reporter by the name of Matt Grant, and he's with KXAN in Austin. And he did some deep investigative work into the Texas Medical Board. And I will just give my plug for investigative journalism because it's a dying art, and we need investigative journalists. We need people like Matt Grant. But he and his colleague, Dalton's last name Huey, I think, Dalton Huey, I'm not sure. I want to give a shout out to Dalton as well. But they went into a deep dive of comparing Texas licensed physicians to other medical boards. And they found many, many, many examples of doctors who had been disciplined in other states, some for pretty horrendous stuff, who, if you went to the Texas Medical Board, they were completely clean. So, we talk about transparency and, patients doing their due diligence. A lot of patients know, well, I'm going to go check this guy or this gal out on the Texas Medical Board. Well, they're clean, so there must not be any problems. But what Matt's investigative journalism discovered, that they found at least 49 Texas doctors whose licenses had been suspended or revoked in other states, and yet they were clean in Texas. As well, a number that had significant medical malpractice verdicts, not out-of-court settlements, but where juries had determined that they had done something that seriously harmed or killed a patient, clean in Texas. And this was because the age-old refrain of the Texas Medical Board is to say, we lacked the resources. Well, we would have done it. We would have queried the National Practitioner Data Bank, but we lacked the resources, so we were left to rely on doctors to self-report. So let me ping it back to you to have you talk with us a little bit about your perspective on the Texas Medical Board, why they always say they can't protect the public because they lack the resources to do so, and your thoughts and impressions about, this report.
So the KXAN coverage of this issue was continued, I think, over a year before the legislative session began. And the thing that they were able to illustrate is that many doctors hold multiple licenses in different states, and that the medical board, as you said, didn't even know that the other states had taken some kind of action. Now, I would say probably they could use more resources to do a better job, but they're pretty reliant on the license fees. And so, one of the things that happened with this legislation was that we had a great House sponsor, Julie Johnson, who's now in Congress, who was so committed to it. She was all in, and that is really important. And she had the backing of all these stories that Matt Grant had done, which is the classic way, especially from a patient advocate who doesn't have a lot of resources, to bring an issue to the public's attention and to the legislature's attention. And so we had that. But then the other thing that happened, and she was instrumental in reaching out to a Senate sponsor who was a Republican, and Bob Hall, Senator Bob Hall. That bipartisan support made all the difference in taking Matt's findings and translating it into changes in the law that specifically addressed some of the things that he discovered. I don't know if you want to talk about that or detail?
Yes, I will. What you were saying sparked an idea in my mind, which is rinse and repeat. This is what we were hoping with the Dr. Death stories, getting millions of downloads of the podcast. A story gets out in the public view. It shocks the conscience of the public. Then somebody, a politician preferably, picks up the problem, proposes a solution, it becomes the law. But it normally doesn't happen that way. This is an example of a success story where it did happen. So what happened is when Matt exposed the problem, I think people were already kind of sensitized to the Dr. Death story, having it emanated from Texas. And the fact that it got bipartisan support was remarkable and very encouraging to people like you and me and others to say, maybe this is an instance where it's not political, because everybody can align around making healthcare safer, more transparent for the patient, and holding the medical board more accountable. So, yes. So the workaround was the legislation, which has now become the law of the land here in Texas. Would you like to talk a little bit about what the law is now?
Sure. And I think, well, I was going to say one thing that Texas Medical Board has in their mission. And frankly, when we looked into every other state, almost all the states have it to protect the public. So that is something the public recognizes and wants. So this bill actually has some very specific things that will address this whole issue of having doctors with licenses in many different states. So one of the things it does is it requires what we call continuous query of the National Practitioner Data Bank. I would just say that it's a national repository of information about actions taken by state medical boards, by drug enforcement agencies, by courts, medical malpractice courts, and there, are 97,000 plus doctors that they aggregate information about. The public cannot access that information, but the medical board can.
Yes.
And what Matt found was that the medical board was not using that resource in the way it should.
Right.
And one of the things that one of our members, Bob Oshel, who used to work for the data bank, raised was continuous query. And what that means, it was under $3 a year to have the data bank notify the medical board, the state medical board, anytime they got a report about a doctor licensed in Texas. That is, seems like a very small amount of money.
Yeah.
Under $3. But when you aggregate it across the state, 9,000, 10,000 doctors, it's a lot of money. And so the implementation is that each doctor has to pay that $253 when they renew their license. That's added as a fee. So this means that if Dr. X gets an action in another state or maybe had a major malpractice decision, the medical board will get a notice about that doctor, and they can choose to keep it in the record or take action on it or whatever. But this is an enormous, this kind of move the medical board into the modern age where they don't have to manually call up the data bank and say, do you have anything on this doctor? Because there's no way they can keep up with that many doctors. So that's, I think one of the major things that's happened is it gives them more information. We still need to see if they're going to take action regarding that information,
Yeah.
but they haven't. The other thing that it did was that it required fingerprinting
Yep.
of all doctors, and there were about 9,000 Texas doctors that did not have fingerprinting, and which seems ludicrous because every job out there, almost all of them,
Gosh.
Daycare, teachers, everything, they have to be fingerprinted, but not doctors. So that was also required. And what that would do would be, connect them if there was a criminal record or something like that of the doctor. They would be able to find that out. So those are two, I think, of the major things that we accomplished in that bill.
Yeah, I can remember being a 25-year-old young woman and going down to the Oklahoma County Jail in Oklahoma City to get fingerprinted before I could have a law license. And, I'm not wielding a scalpel. But, just a couple of things on that. What the medical board said is they would have loved to have been doing this continuous query all along, but they lacked the resources to do so. The technology existed, but they said they lacked the resources to do so. But yet, the Texas Medical Board never went to the legislature or anyone and said, hey, there's this technology that exists, and right now we're just having to rely on doctors to self-report, but we want to be able to use this technology, and we would like some legislation to fix this. It took a public shaming. And then they kind of jumped on the bandwagon. I'm sorry, maybe this isn't fair, but in my opinion, they were like, oh, this is so great. We're so happy to have this legislation because we wanted to do this all along, but we just didn't have the money to do so. We couldn't afford it. We could have protected patients, but we didn't have the money to do it. So, I'm just going to call bull on that. But it's so interesting to me that the other problem is that when they caught a doctor red-handed not reporting things, oftentimes there were no repercussions, no punishment for the doctor. Right off the top of my head, because I've been practicing medical malpractice law for so long, every time I talk about something, I'm like, well, I could give you 100 examples of that. But, being in a deposition of a doctor, the doctor got the day before this malpractice occurred, he had been arrested for DWI on his way to the hospital. He was on call and he had been called in. He's pulled over for DWI on his way to the hospital to see patients. For all I knew, so I guess he gets out of jail and goes back to work the next day. Guess what? He's completely clean on the medical board. So he's asked under oath, did you were required to report that to the medical board? Oh, it's just an oversight. To my knowledge, to this day, that doctor has never been disciplined for not letting the medical board know that he was arrested for drunk driving on his way to care for patients. Pardon the rant, but...
This is a real problem when we talk about transparency, because the medical board does have some information that they don't share, but they also rely, as you said, on doctors self-reporting problems that they might have had. In fact, I think on the actions in other states, it was all self-reporting before this bill passed. So some doctors were honest and some were not.
Yeah.
But the medical board did not check it and look at, check with all the medical boards that they're licensed by and, and see if they're actually clean. And one of the things that PSAN has worked on, we've put out 2 reports, the last one in 2022, where we looked at physician profiles, which is a page on the medical board sites and across the nation for every physician. And so we've worked for many years. We started when I was at Consumers Union and Consumer Reports, and have continued that work to try to get those profiles to have more information. And we evaluated all the medical boards to see if they had 16 pieces of information that we felt every consumer, everybody at the public who's looking up a doctor should be able to find out. Texas rated actually close to the top, 10 out of 16 things. So there were 6 items that we felt that Texas should provide to the public. They didn't. And one of them was the number and type of complaints that each doctor has received. The nature of the complaint, like, was it a standard of care, or was it just paperwork, or what was it that brought them to their attention? And another is they do not post federal actions or hospital actions. When a hospital, and your discussions about Dr. Dunch actually illustrate this very well. When a hospital takes an action against a doctor or asks them to leave, that should be reported to the medical board. And we want patients and the public to be able to see those reports. As it is, there are very few reports made because a lot of hospitals just allow the doctor to sort of go on their way and go somewhere else and maybe harm someone else. So we do feel like federal actions, drug actions, medical malpractice actions, all should be on that profile. Texas does provide limited information about malpractice cases or malpractice payouts, but very limited. And we want to see all that information on the profile that is available to the public. So there are a lot of things that aren't there, but there are a lot more things that are there that weren't there 10 years ago. And I think it's because of our advocacy on this issue.
Yep. Patients should check their doctor on the Texas Medical Board website, and we can post something in the show notes. It's easy to navigate the website, but they should also know that just because a doctor's clean on the website doesn't mean there's a clean history. There's still lots and lots of things that could be going on in secret that are not known to patients. Christopher Dunch?
I would say one of the things that people should do is Google the doctor's name and see if that doctor's been in the news. Because often, if it's something fresh, it's not going to show up on the medical board site.
That's good advice. But I will say, I had real life clients of Christopher Dunch who did their due diligence, and not only was he clean, but he had some slick videos promoting him, and man, he looked great on paper, so you never know. But, I would just say this, this thing about, we would have loved to do that. We don't have the resources. There's 80 to 90,000 physicians in Texas. Tacking on whatever it is, $2.50 a year to their license fees is, what is that, the cost of one Starbucks or less? I can't think of a physician who couldn't afford $2.50 a year. In medical malpractice land, we talk about issues of foreseeability, the foreseeability of harm. And I'm going to put that on the shoulders of the Texas Medical Board. They know that not all physicians are honest people. So when you allow people to self-regulate, there's going to be some that will and some that won't. So, there's that. I will also say, you talked about the Texas Medical Board's mission. Their mission is to protect and enhance the public's health, safety, and welfare. The mission statement does not, nor has it ever said, the TMB's mission is to protect and enhance the lives and well-being of physicians. So I wanted to kind of end on this topic, which is, we know the Texas Medical Board and many medical boards across the country have failed in their mission to protect patients, and that many of them tend to get into an institutional mindset of protecting physicians. And, some of the reasons I believe for this is that many of the board members are physicians themselves, and they're political appointees. And so there becomes this us versus them, professional solidarity, us versus patients, or certainly us versus lawyers. We see time and time again, Dunch is a prime example, but thousands of examples prioritizing the due process for the doctors. Let's give the doctor the benefit of the doubt. Let's give them all their due process rights. Let's give them opportunities to lawyer up and go through the whole process. And when they do act, they rarely impose forceful sanctions, but they tend to focus on the low-hanging fruit, administrative matters, technical missteps, so on and so forth. So I would just say, my question for you would be, what the heck? What is going on?
Well, I hate to get back to the resources issue, but, one of the things that's going on is that it's pretty costly to bring a full case against a doctor who's very well lawyered up. Mm-hmm. And so you can have a doctor who clearly has harmed patients. And I might say that Texas is one of the few states that does publish their legal documents that are the legal charges that say, this patient and this patient and this patient were harmed, and what happened to them. Yeah. So there is something that you can see, but often when it comes to taking action, the only thing they can easily negotiate with the lawyers is problems with the paperwork or minor issues. Yeah. That's how they get them on probation. And I understand it. I don't like it. Yeah. It's not fair to patients. It is, it may be practical for an agency that doesn't have many resources. Many of the lawyers who work for the agency are young, inexperienced. So all of those factors come into play, and I've watched it all for decades. Yeah, and it happens all over the country. But that's no excuse for what we see happening in most medical boards. There is so much that can be done to get them to make it clear that patients are the priority. One of the ways may be to have more public members on the board and fewer doctors. And in many states, the medical association makes recommendations about who should be on the board. So it really is sort of, I think you use the term self-regulating. That's very, very frustrating. I would love to see totally public members and use doctors on committees to go over the medical stuff. Yeah. Because the public is such a different view on what should be happening than the medical board. And I think that the public can be fair. And I think the other thing is that The Texas Med, I don't know, I should have looked this up, how many complaints they get, but thousands of complaints, many thousands every year.
Mm-hmm.
And they take action on such a small number
Yeah.
of them.
Yeah.
So we know that that is what's happening. I think it happens with hospitals and nursing homes and all of those. But if we don't see what's coming in the door, the numbers and why they took certain cases and didn't take others, then it makes people like me think that they're not doing their job properly, and that there's no accountability. So I think, again, transparency about the kinds of complaints that are coming in is a very important piece of information that we should see. And that same 2011 survey that Consumer Reports did, 81% said they want to see complaints with the patient name redacted.
Yep.
So I've myself, in my work, I have reviewed complaints in other agencies. And when you can read what a patient said happened, it makes a world of difference than just reading, oh, this doctor violated a standard of care. That kind of transparency is really important in bringing accountability.
It is, and I would say two things. It is great that for the few doctors that are disciplined, you can read the allegations, but they're so distilled down that it's, a little bitty paragraph and it's kind of vanilla-ish. And then if I see one more time, I'm going to probably throw up. I'm sorry to be that way about it. The doctor was required to take a 12-hour course on medical jurisprudence. I'm like, what the heck? What is medical jurisprudence anyway? But whatever. And the other thing that I would say is, you were saying you think public members could be fair. I guarantee they can be fair. Why do I know that? Because in our civil justice system, we take 12 people off the street and we educate them on difficult medical concepts, and they understand them, and they're able to reach results that have very large consequences on people's lives, on the doctor's life, on the hospital's life, on the patient's life. And they don't always get it right, but it's the best system we have.
That's a good example. That's a really good example.
There's also, and this is a wild idea, nobody will ever take me up on it, but there's also a lot of lawyers like me, and I'm not volunteering, but there's a lot of lawyers in medical malpractice, both on the defense side and on the plaintiff side, who would do pro bono work, who would, if there wasn't any kind of a conflict of interest, would say, if you lack the resources to do a full-blown prosecution of a doctor who's lawyered up, we'll put together a little pro bono team. We'll come in and help you. It's our obligation to the bar and to our fellow citizens. But they would never.
Do you mean help the medical board?
Yeah.
Yeah, that would be a great idea. I love it.
They'll never say yes. Right now we have that issue going on where we passed that legislation. We could talk about that again, and I raised my hand like, I'll serve on the board. And they're like, oh, God, no. Don't let her anywhere near this. And I'm like, the thing about it is I'm a very reasonable person. I really am a very reasonable person. But people hear plaintiff's medical malpractice lawyer, they're like, she must be just a complete one-sided person, but not so.
Yeah. And I think it's really important that we talk about, while many people are harmed by doctors or hospital care, and they need money to help take care of them, because of the harm caused. Most people who are harmed or who have lost a loved one they want to be sure it doesn't happen to someone again. And a lot of, I would say many more than not, aren't looking for money.
Yeah.
They're looking for change. They're looking for behavior to change.
Yeah.
And often lawsuits are filed because that's the only way they can get information, because there's a wall of secrecy.
Yeah.
And nobody wants to talk about it. And so they have to get a lawyer and do depositions to find out what happened to their loved one. And that's a very common scenario.
Yeah.
And often people are portrayed as just wanting the money. But my experience over the decades is that most people want this to not happen to someone again. And sometimes when it comes to doctors, that involves taking away their license.
Yep.
They need to be doing something else.
Yep.
They should be seeing patients who trust them to take care of them. And that's, the plain truth.
100%, actually 1,000%. And so many people, that I've looked in the eyes of the grieving family or the catastrophically injured patient, and it's so just amazing. People amaze me, their resilience, and I've been made a better person as a result of all the people's lives I've been privileged to be a part of. And it just shakes you to your core when somebody who has endured so much that wasn't their fault, they say, it's not about me. I just want to prevent somebody else from getting harmed. You're just like, what a great human being. So I think that's probably a great place to end it, Lisa. I could just talk to you forever. And I hope that this hasn't been a terribly miserable experience and to come back for another episode.
We have lots of things to talk about.
Thank you for joining us for another episode of AdvoKAYte. And I hope you enjoyed Lisa McGiffert as much as I enjoy talking with her. The big challenge with these podcasts is trying to distill down in under an hour conversations that could go on for many hours. So we'll definitely have Lisa back for future episodes. And to the point she was talking about, it doesn't matter who you get in touch with. If you've been affected by a preventable medical error, or you're somebody who works inside the healthcare industry and you want to be a part of the solution, you can contact the Patient Safety Action Network, or you can contact me directly. My direct to my inbox email are my initials KVW at vanwaymetzler.com, or you can send a message through Instagram. Please follow us on YouTube. Tell your friends, families to follow the podcast. Appreciate your time. Thank you for listening. Take care.